Got a 75-year-old lady who's at some point fallen off a stair lift, having been found at the top of the stairs initially on the stair lift, unresponsive. So the obvious thing here is to decide whether the fall from the stair lift has contributed to her death. Looking through the chest from the top to the bottom, what we have got is a couple of relatively subtle but definite rib fractures at the back on the left side. So we can see the contour of this rib here is depressed, it's lost its normal contour, and there's a definite fracture of this rib here. Rib fractures on their own are unlikely to have caused someone to die, but what is important when you see traumatic injuries to the thoracic cage and the ribs is to establish whether there's any underlying injury to the lung, which can be fatal. In this case, there's no evidence of any bleeding around the lung, and there's no evidence that the lung has collapsed. I think what we're looking at now is what's happened to the patient, presumably before she's fallen off the stair lift. So the obvious thing that jumps out at me here is this heart is enlarged. The way we assess heart size is to compare the diameter of the heart itself with the diameter of the thorax. And we're looking for a ratio of anything over sort of 0.55 is abnormal. When we work the maths out here, the ratio is over 0.61. So this heart is obviously significantly enlarged. And the other thing we need to assess is the coronary arteries, which are the arteries that supply the heart muscle itself. And we can see that there's significant disease in the coronary arteries.